Yes.
It can.
In short, it can even come from an OT or assault, but um, um, an OT or assault is really only going to be backup evidence. If it's only coming from an OT or assault, it is
Yeah.
very unlikely that that will be enough. If it's coming from an EP backed up by an OT or assault, fabulous.
Yeah.
Yes, mental health professionals of any sort, mental health nurse, psychiatrist, clinical psychologist, yes, because they ultimately it is, if it's mental health that's making a school setting inappropriate, then they would be an ideal person for that. But EPs will still have some relevance. I have been in tribunals where all of the mental health professionals are saying absolutely no school, and an EP is saying, the local authority EP is saying absolutely, we've got this school that can do gradual exposure therapy and it'll all be fantastic, and they've done it 100 times before and solved all of a child's anxieties through just this
Yeah.
route. And so if you've got an EP on board as well, even better. But you can use an independent. And as Sarah said in her presentation, local authorities are very likely to discount it. You'll hear, we're not allowed to accept independent reports. And then when you ask them, please, can they show you either the law or the policy that states that, they go very quiet on you because there isn't one. But the judge will put, a judge at tribunal will put just as much weight on an independent as a local authority. In fact, I always call it a game of top trumps. What they will do, if they've got two competing EP reports or views, they'll look at who's the most qualified, who's the most experienced, who they trust the most. And that is not always, but that's actually often the independent.